Doctors and researchers point to a number of likely causes, like kids missing out on PE classes when schools went virtual during the pandemic, activities like sports being put on pause, and people in general leading a more sedentary lifestyle as they stayed at home more.
The fact that this was reflected in reductions in fitness, I think really points to how much their physical activity was probably reduced, because it probably takes a substantial change in physical activity to influence a kid's fitness.
According to the SC Fitness Gram Project results, 2 out of 5 students across South Carolina are now considered overweight or obese. Data shows heart and lung health declined by 9%, and more than half of the state's students don't meet the national standards for cardiorespiratory fitness. Children living in poverty also scored worse on every measure. Dr. Deborah Greenhouse, a Columbia pediatrician, says these results match what she's seen in her office every day since the pandemic.
More kids dealing with problems with weight gain, more kids dealing with problems of not having access to healthy foods, and kids in general just not being as active as they were before, not getting as much exercise.
And to turn this trend around, Dr. Greenhouse says the state and schools are going to have to improve kids' access to physical activity and to healthy foods. She points to a bill that's been filed here at the State House that would provide free school meals to every student in South Carolina as a great place to start toward that latter goal. Reporting from the State House, I'm Mary Green.